I'm Dr. Wes Kennemore, President of EAM Solutions, and let's get ready for a medical mission to Honduras. In July of 2021, EAM Solutions joined E3 Partners on a church planting and medical mission expedition to La Ceiba, Honduras. In preparation for our expedition, tens of thousands of vitamins, antibiotics, and other medicines were packed into individual doses with patient instructions in Spanish. And now it's time to get packed up and ready to go. Let's see, scrubs, pants, shirts. Now where did I put that stethoscope again? Jenna. 3 a.m. already? It turns out the first leg of our journey was a very early flight out of Birmingham, and quite frankly, I just wasn't thinking clearly enough to take any pictures. But we met up with some of our expedition team in the Atlanta airport, and before long we were on our way to San Pedro Sula, the international airport in Honduras. From all over North America, the team arrived in waves and assembled at the airport in San Pedro Sula. As we began our landing approach, we could see that Honduras was a beautiful country. San Pedro Sula is fairly typical of the Central and South American airports that we fly into. But the bus? Well, that was another matter. Our mission team set out on a 3-hour journey for La Ceiba. Yeah, you remember that 3-hour tour?
5 passengers set sail that day for a 3-hour tour. A 3-hour tour.
Five hours later, we arrived in La Ceiba, a beautiful little town right on the Caribbean Sea. And we found our quaint little hotel in La Ceiba called Hotel Carnival. We're here in La Ceiba in Honduras, on the northern coast of Honduras, right up against the Caribbean Sea. We flew in last night. I didn't get much chance to do a lot of video, but hopefully I did get a few pictures, a few videos. We'll sprinkle those in along the way. We're getting ready to go down for breakfast, getting ready to start setting everything up and sorting all of our meds, getting ready to set up for our first day of clinic, which will be tomorrow. But looking forward to a great week and a great trip, and we'll talk to you soon. This is the Hotel Carnival in La Ceiba. That's the little tiny bus we rode in on last night. We packed about 35 North Americans in that bus, and it's a small bus. It's built for about 20 Hondurans, and as you know, the average North American is just a tad larger than the average Honduran. But we're here. The landscaping around here is really beautiful. I don't even know what these trees are called, but I'll have to find out in the bushes. I have to find out what they're called before I go back. Getting ready to start setting up for our first day. We'll be going into clinic tomorrow, but great little place. We had about a 5-hour drive from the airport. You know, I never did find out what those plants were called. While we had planned on doing 5 days of clinic, one of our nationals had surprised us and told the hotel staff that we would be happy to do a medical clinic just for them. So on Monday, we had a pop-up medical clinic just for the hotel staff and their families. If you're wondering how one of our medical clinics works, we provide free nursing evaluations, medical consultations, dental cleanings and extractions, as well as reading glass evaluations, free reading glasses, free medicines, and spiritual counseling. And of course, if your team is led by an epidemiologist, you have to assume you're going to do some public health teaching. Here, one of our nurses is seen teaching some local Honduran children the proper way to brush their teeth. Since most of us don't speak Spanish, We would be useless without our translators. A local church donated their entire facility for our first full day of clinic on Sunday. This is a much larger space than we usually have, but it provides a great opportunity to show the general workflow and how a clinic might be laid out. Let's drop in on Dr. Ryan, our dentist, treating one of our Honduran patients. Seriously, Dr. Ryan? What's up with those bright orange Tennessee Volunteer scrubs? At this site, we were fortunate enough to have a private office for our nurse practitioner to use as a treatment room. We were also incredibly lucky to have 2 local Honduran physicians join us today, and here we see them treating a local pediatric patient.
You gotta love how hard these nurses work to put even our youngest patients at ease.
As I mentioned earlier, we were able to provide reading glasses to many of the local Honduran population. But of course, this little dude and this little dudette, they don't need reading glasses, but we couldn't let them go away empty-handed. Here they are sporting their cool new sunglasses.
And I was incredibly honored when our clinic staff dedicated the 4th of July clinic to my recently deceased father, a retired Naval Chief Petty Officer.
And of course, no 4th of July would be complete without a celebration after dinner, including fireworks and party poppers. At one of our clinics, over 170 patients were waiting when we arrived. But these nurses are always working with a smile on their face, no matter how much stress they're under. Sometimes in the middle of all the chaos, the boss just has to add a little levity. And who wouldn't want their picture taken with a Honduran fire engine? Or if you happen to be a retired firefighter, maybe you'd like your picture taken with the entire local Honduran fire brigade. And then there was, no, don't ask. But all day long the patients kept coming, over 300 in all, waiting in the hot Honduran sun for hours just to see the American medicos. And what was that Bible verse about a cup of cool water? Each day our medical team piled into our tiny bus and set out across the pineapple plantations to hold clinics in remote areas for patients with little or no access to health care and medicines. The local medical community continued to amaze us by donating their time to help in our efforts. Here, another of the local providers joins us one day in an outdoor clinic. Yes, outdoors in the Honduran heat and humidity. Oh, and did I mention the nurses?
No, I said we're not going to talk about that one. And when it rains in Honduras, it rains. One clinic was held on a football court, and one in a very small and cramped space with no ventilation.
In an unexpected turn of events, our medical team was able to gain entrance to a local prison by providing much-needed vitamins and medicines to the prison infirmary. We were also able to provide spiritual support to several prisoners and open the doors for a local pastor to provide follow-on counseling and support in the future. And yes, there were several armed guards with assault rifles in the room. The local TV station even showed up to document the goings-on.
A portion of the medical team was able to visit a local hospital to gain a better understanding of the differences between Honduran and American healthcare. One of our church planting teams requested that we visit a lady who was scheduled to travel to the U.S. the next day, but she was too sick to make the trip. We were able to provide medications that stabilized her condition and to redress an infected surgical wound. We found out later that she was able to make the trip successfully. I was absolutely overwhelmed with the heart and dedication of this American medical team, as well as the Honduran doctors, dentists, and nurses who joined us. These amazing people did whatever was needed, from babysitting little ones to give parents a break, to hauling heavy suitcases of medicines and medical supplies, helping elderly patients to read again for the first time in years, providing much needed vitamins and medicines, and most of all, providing spiritual support. Whenever I offered one of these team members a choice of assignments for the day, the answer was always the same: whatever you need me to do. A leader could not ask for a better team. Thanks to their hard work, we were able to provide assistance to over 1,300 patients in the 5.5 days of clinic, and many lives were changed forever. Yes, Charlotte, there really is a Pizza Hut in La Ceiba, Honduras. I said no.